Monitoring glucose levels and ketones. In diabetic management, there are 5 steps: nutritional management, exercise, monitoring, blood glucose level, pharmacologic therapy, and education. The third one is monitoring glucose level and ketones. Blood glucose monitoring is a cornerstone of diabetes management, and self-monitoring of blood glucose, shortly called SMBG, levels by patients has dramatically altered diabetes care. This allows for detection and prevention of hypoglycemia and hyperglycemia and plays a crucial role in normalizing blood glucose levels, which in turn may reduce the risk of long-term diabetic complications. Various SMBG, that is self-monitoring blood glucose methods, are available. Most involve obtaining a drop of blood from the fingertip, applying the blood to a special reagent strip, and allowing the blood to stay on the strip for an amount of time specified by the manufacturer, usually 5 to 30 seconds. The meter gives a digital readout of a blood glucose value. The meters available for SMBG offer different features and benefits. Newer monitors have eliminated the step of blood removal from the strip. The strip is placed in the meter first before blood is applied to it. Once the blood is placed on the strip, it remains there for a duration of the test. The meter automatically displays the blood glucose level after a short time, less than 1 minute. Some meters are biosensors that use blood obtained from alternate test sites, such as the forearm. They have a special lancing device that is useful for patients who have painful fingertips or pain with finger sticks. Disadvantages of SMBG systems. Factors affecting SMBG performance include visual acuity, fine motor coordination, cognitive ability, comfort with technology, willingness, and cost. Some common source of error include improper application of blood. Example, drop is too small. Second one, improper meter cleaning and maintenance. Example, allowing dust or blood to accumulate on the optic window. This is not an issue in the biosensor type of meter. Damage to the reagent strips by heat or humidity. Use of outdated strips. Candidates for SMBG. It is also recommended for patients with unstable diabetes, a tendency for severe ketosis and hypoglycemia, and the third one is hypoglycemia without warning symptoms. Frequency of SMBG. For most patients who require insulin, SMBG is recommended 2 or 4 times daily, usually before meals and at bedtime. For patients who take insulin before each meal, SMBG is required at least 3 times daily before meals to determine each dose. Patients not receiving insulin may be instructed to assess their blood glucose levels at least 2 or 3 times per week, including 2-hour postprandial test. Responding to SMBG results. Patients are instructed to keep a record or logbook of blood glucose levels so that they can detect patterns. Testing is done at the peak action time of the medication to evaluate the need for dosage adjustments. To evaluate basal insulin and determine bolus insulin doses, testing is performed before meals. To titrate bolus insulin doses, regular or Lispro, testing is done 2 hours after meals. Patients with type 2 diabetes are encouraged to test before and 2 hours after the largest meal of a day. Patients who take insulin at bedtime or who are on insulin infusion pump must also test at 3 a.m. once a week to document that blood glucose level is not decreasing during the night. If the patient is unwilling or cannot afford to test frequently, then once or twice a day may be sufficient if the patient varies the time of day to test. That is example, um, before breakfast one day, before lunch the next day. Glycosylated hemoglobin. Glycosylated hemoglobin, referred as HbA1c, is the blood test that reflects average blood glucose levels over a period of approximately 2 to 3 months. When blood glucose levels are elevated, glucose molecules attach to hemoglobin in the red blood cell. The longer the amount of glucose in the blood remains above normal, the more glucose binds to the red blood cell and the higher the glycosylated hemoglobin level. This complex, the hemoglobin attached to glucose, is permanent and lasts for a life of the red blood cell approximately 120 days. If near normal blood glucose levels are maintained with only occasional increases in blood glucose, the overall value will not be greatly elevated. However, if the blood glucose values are consistently high, then the test result will also be elevated. If patients report mostly normal SMBG results but the glycosylated hemoglobin is high, there may be errors in the methods used for glucose monitoring, errors in recording results, or frequent elevations in glucose levels at times during the day when the patient is not usually monitoring the blood. Various tests measures the same thing but have different names, including hemoglobin A1c and hemoglobin A1. The normal values differ slightly from test to test and from laboratory to laboratory and normally range from 4 to 6%. Values within normal range indicate consistently near normal blood glucose levels, a goal made easier by SMBG. Urine testing for glucose. Before SMBG methods are available, urine glucose testing was the only way to monitor diabetes on a daily basis. Today, its use is limited to patients who cannot or will not perform SMBG. The advantages of urine glucose testing are that it is less expensive than SMBG and it is not invasive. The general procedure involves applying urine to a reagent strip or tablet and matching colors on the strip with a color chart at the end of the specified period. Disadvantages of urine testing include the following. Number 1, results do not accurately reflect the blood glucose levels at the time of the test. Number 2, the renal threshold for glucose is 180 to 200 mg per deciliter or 9.9 to 11.1 millimole per liter for above target blood glucose levels. Third one, hypoglycemia cannot be detected because a negative urine glucose result may occur when the blood glucose level ranges from 0 to 180 mg per deciliter or higher. If it is in millimole, that is 9.9 millimole per liter. Fourth one, patients may have a false sense of being in good control when results are always negative. Number 5, various medications, example aspirin, vitamin C, some antibiotics may interfere with test results. Sixth one, in elderly patients, the patients with kidney disease, the renal threshold, the level of blood glucose at which glucose starts to appear in the urine is raised. Thus, false negative readings may occur at dangerously elevated blood glucose levels. Testing for ketones. Ketones or ketone bodies in the urine signal that control of type 1 diabetes is deteriorating and the risk of decay is high. When there is almost no effective insulin available, the body starts to break down stored fat for energy. Ketone bodies are byproducts of this fat breakdown and they accumulate in the blood and urine. Urine testing is the most common method for the self-testing of ketone bodies by patients. A meter that enables testing of blood for ketones is available but not widely used. Most commonly, patients use a urine dipstick to detect ketonuria. The reagent pad on the strip turns purplish when ketones are present. One of the ketone bodies is also called acetone, and this term is frequently used interchangeably with the term of ketones. Other strips are available for measuring both urine glucose and ketones. That is called ketodiastics or chem strip. Large amounts of ketones may depress the color response of the glucose test urea. Urine ketone testing should be performed whenever patient with type 1 diabetes have glucosuria or persistently elevated blood glucose levels. That is more than 240 mg per deciliter or 13.2 millimole per liter for 2 testing periods in a row. And during illness, in pregnancy with pre-existing diabetes and in gestational diabetes. So type 1 diabetes, if more than 240 mg per deciliter of glucose level, and in pregnancy with pre-existing diabetes and in gestational diabetes. Thank you.